Now, welcome back to the Sports Medicine Project. Now, today I'm sitting here with Dr. Kim Hébert-Loser. Kim, thanks so much for coming on.
Thanks for having me.
Very good. Now, we're just saying off air, I was very worried about pronouncing your last name because when you said it, it just rolls off the tongue. So are you originally from France?
No, I'm
Is that
originally
right?
from the French part of Canada. So I'm a
Right.
French Canadian. So yeah, it's pronounced Hébert-Losier.
Yeah. Wow. That sounds awesome when you say it. But you're in New Zealand, so how did you end up there?
Yeah, it's a little bit of a long story, but yeah, I trained as a physiotherapist in Canada, and I worked for a few years there as a clinician and primarily in musculoskeletal practice. And then I actually did my PhD down in Dunedin at the School of Physiotherapy. And so I was based there for 3.5 years studying calf muscle function. And then afterwards, briefly went back to Canada to continue to work as a clinician. And then I did a series of postdocs. So ended up in Sweden working there and developing my skill set and more in sports biomechanics, and ended up meeting a New Zealander in Sweden that I ended up marrying. Yeah, then from then on, he's also an academic, so we ended up in Lincoln, Nebraska for a year, worked for 2 years in Malaysia, and then finally we both kind of secured jobs here in New Zealand and came back, yeah, 10 years ago now, so time flies.
Yeah, and if you don't mind me asking, what part of academia? Is it health or what area?
Yeah, no, so I am a associate professor for our School of Sport and Human Movement. So it's more like an exercise science-based program or
Mm.
kinesiology, depending where you are in the world.
Yeah, yeah. My partner is a physio, and she has a real interest in the lower limb. And we find that we just talk around research and academia and kind of things related to our field quite a lot. And sometimes it can be hard to switch off. Does that happen to you?
Yeah, yeah. I mean, obviously, it's kind of like a blend of work and life for us.
Mhm.
Maybe a little bit less of a balance, but more of an integration, I guess. But yeah, my partner is one of my best colleagues. Obviously, super supportive of each other's. Yeah, it is. It does make for some interesting dinner conversations. But yeah, it's good now because I we have a young son. He's 8, and he's a little scientist himself, and he loves doing experiments and things, and kind of wonder if we have something to do with that. But yeah, we'll
I
see.
think so. That's so sweet. And tell me, what's a week look like for you? Because your title sounds awesome, and I remember when I first saw you speak at the podiatry conference. I remember you putting up this image of where you are, and it looked amazing. It looked beautiful. So yeah, what's a week look like for you and your facilities?
Yeah, I mean it is a nice place to be. So I live in Tauranga, so I work for the University of Waikato, which most people will associate with the Hamilton region of New Zealand. But I'm fortunate to be in a satellite campus, and basically our sports science laboratory is based where the All Black Seven train. We also have a semi-professional rugby team here and the youth and development. So it really is kind of like a sports science center. I think like most academics know no day nor week is quite the same. So I've just kind of come off of my more research time and obviously summer. So, working a lot with my postgrad students, trying to get research off the ground, trying to finish research that, that we've done in the past. And then, yeah, we're just starting teaching here at the uni next week. So, yeah, a little bit more of, yeah, trying to build the next generation forward and inspire young minds.
Yeah, and we'll have your LinkedIn where you share some of your research, obviously tagged below. What is your interest? Is it biomechanics? Is it movement? A combination of all of them. Do you have an area? Because obviously you've published in quite a few, and we're going to talk around advanced footwear technology and super shoes and calf muscle function today. But I know it's very hard to say. Can you isolate one? But what do you enjoy the most?
Yeah, so I mean, fundamentally, I'm a clinician by training, and I often joke that I went to the dark side of the numbers and ended up doing biomechanics and kind of knowing what I do now. I kind of wish I had done engineering. I think I really would have enjoyed it. But at the same time, it kind of puts me in this unique translational space where I I can understand the numbers and apply it to, human movement for optimizing performance or reducing injuries. So I kind of sit within that space. Fundamentally, I kind of define myself as an expert in lower extremity movement. And obviously with a particular area around, the calf muscle, calf and ankle complex, along with, footwear and gait, primarily running gait. So that would be kind of like in a nutshell where
Mm.
I sit.
Yeah, and I mean, your like physio background, but like that's we joke in the podiatry world that we've got it pretty simple as podiatrists because everything that we do is pretty much related to the plantar flexors, the relationship between obviously the calf and the foot. So thinking more about them, you've obviously spent a lot of time uh, learning and researching and creating information about the calf. I mean, was was there anything that you thought initially that you've really changed your mind on the function, on the endurance, on the strength, or even just your clinical ability of understanding the calf? Like, what do you think since you very first started?
Yes, I think fundamentally, really one of my first studies when I did my PhD. My PhD was on the calf raise test or the heel rise test, or depending, repetitive plantar flexion test, however you want to call it, where you do calf raises to fatigue. And in our clinical textbooks, when I was a clinician or training to be a clinician, we were told that doing the calf raise test with the knee straight and the knee bent was a mechanism to kind of shift the test from being more gastrocnemius dominant to being more soleus dominant. And my whole PhD was basically around that topic. And in a nutshell, took about 3 years, but by the end of it, what we showed was that it actually didn't really matter whether you did the test with the knee straight or the knee bent. So the gastrocnemius muscles and the soleus muscles were just as active and basically kind of fatigued at the same rate, whether or not the knee was straight or bent. And primarily, I think that's because, you can't do a standing calf raise test with enough knee flexion to actually shift that relative kind of contribution of the soleus muscles to the plantar flexion output. So really kind of like one of my first study was kind of what I feel changed my view in terms of testing of the calf muscles from a clinical perspective. And obviously, like since that time, I've been very fortunate to work with Carlos Balsobros Fernandez, who helped me develop an app to help clinicians further quantify calf raise performance. And we've known for a while now from the work of Silbernagel's lab in the US that just counting the number of repetition that someone does is quite limited in terms of identifying functional deficits in individuals, because obviously you can do calf raises and rise this much, or you can do calf raises and rise that much, and then if you're rising this much, you're obviously completing more mechanical work. So I think if we're just counting the number of repetitions, we're missing a little bit in terms of potential functional deficits that could help inform our clinical practice. So looking to further objectivize some of the clinical tests that we use as well, I think is increasingly important now.
Yeah, so you said in the clinic, and we'll have that down in the show notes. You raised an interesting point around the bent and straight knee. So I guess the clinical application of that. So if the goal is strain to the muscle or the tendon, let's say an Achilles tendinopathy, and we want to induce some strain to induce some change. When would we do one versus the other? Is it better just to do the one that's the heaviest and you can get the most strain and the most consistency, which for most people is going to be straight knee? You can lock out and you can really go heavy and maybe a bit better technique, which might mean a little bit more ankle dorsiflexion. What does it mean?
Yeah, so again, just so it's, I'm not being misunderstood or not putting things out there. So I'm
Mm.
just purely talking from a muscle activation and muscle
Mm.
fatigue standpoint. So
Yeah.
obviously the internal strains on the structures like the Achilles tendon, for example, or, the different fascicles within the tricep muscle complex will obviously be different if you change
Mm.
the relative positioning. So if you change the knee angle, we know that if you internally rotate or externally rotate, or if you do limited range, and obviously I've recently published some work as well looking at whether or not you're doing this specific test from an incline versus from a step versus from the floor. Obviously the range of motion will affect the loading on the internal structures as well. I'm not saying it's not useful. I'm just
Mm.
saying that it's potentially not doing what we thought we were doing in terms of a muscle
Mm.
recruitment standpoint. So and obviously Seth O'Neill is quite known in this area as well. And one of his thing is that if you stay away from people's kind of deficits, or where they might experience pain in a certain kind of dorsiflexion position, or it might be with the knee bent in a certain ankle position that actually causes some of their symptoms. Well, if we always stay away from the pain provocation and don't get them stronger and to deal with that component, then we're probably not actually addressing the problem as well. So there are some situations, obviously, where you want to do that, but from a purely kind of testing perspective, I typically just say, start with the knee straight, and if they start to bend the knee a little bit, it's not the end of the world, and they just know that you'll get to fatigue basically in both of those positions.
And the normative values, so when you're capturing that, what's, I guess, the cohort of people that you're using, and how do you interpret what that means for people? Like, is it something that, can we assume this is the average, this is where most people should be? Obviously, we're not going on to say that means this won't happen or this will happen, but yeah, how do you kind of interpret that?
Yeah, I think it's like anything else that's out in the literature. If you don't know what's normal, then it's a little bit challenging to actually then make some recommendations, or, know whether or not they're substantially weak or that they're substantially, endurant, for example. And so I think it does give us a starting point. Now, obviously, again, in the textbooks, typically we'd say, if someone can do 20 or 25 calf raises, for example, then that's about normal. But again, that depends, like, so if you're working with a more elderly population, and you have someone that's coming in your clinic and they're 80 years old and they're doing 25 calf raises, I mean, that's awesome. So they're well above their normative values. So I think there's some contextual factors that we need to take into account as well. Fundamentally, we know that generally from the literature that females tend to do slightly less calf raises, for example, than male, up until actually when we get older, and then we start to outperform men, which is great. So go us. But again, there's some of those aspects. But I think we also underestimate the capacity of the calf muscles often. And really, like some of our early work that we did in Swedish cohort, I don't know if they're just more active than the rest of the world, our normative values were closer to 30 within that cohort. And also, it's important that you look at how people were doing the testing to dictate those norms. So most of my research is conducting with the heel, with the foot starting on a 10-degree incline, which increases the range of calf motion that people go through. And we know that actually you will perform less repetitions if you're going through a greater range of motion. Now, most clinicians would do the testing from the ground. So if you're using established normative values of 25 that were actually established from an incline, and you're saying, yeah, that's good. Well, actually, if you adjust, they should probably be doing 30 or 35 because you're doing it from the floor instead of doing it from an incline. So it's really important that if you are using normative value, that you make sure that you follow the protocols that people are actually using, because it will influence your relative interpretation.
And I'm a really big believer in resistance training and movement, with some type of load, just because of the very clear in the literature how much benefit you can get. Do you think, if someone comes into the clinic, let's say someone listening to this podcast, and someone comes in with maybe some knee pain, maybe a little bit elderly, potentially a falls risk, or there's someone that's maybe had some calf or Achilles pain, let's say years ago, and you do this test, and let's say there's an asymmetry, they can do 10 on one side and let's say 30 from the other. Do you think although we can't say that you getting the other side to do 30 is going to significantly reduce your risk of injury, it makes logical sense to maybe work towards that, even if they were having no trouble there, because it's kind of those normative values?
Yeah, absolutely, I agree. And I mean, in the calf space, and for this test in particular, one of the things that I generally like is that we tend not to find a difference between sides. So in healthy, uninjured individual, their dominant and their non-dominant leg and their right and left leg tend to perform the same on this test. So in an absence of a norm, actually your person, like if you have an injured person with a unilateral injury, the contralateral limb might actually help you to set that initial starting point in this particular case. Now, obviously, that's not always the case. And we know that, if you have an injury on one side, it can actually negatively impact your performance on the other side. But in generally for the calf muscle, it seems to be the case that the contralateral limb can act as a good reference point. And I kind of put that down because, obviously when we walk, when we run, when we go up and down the stairs, you use both of your sides, your limbs the same. So unless you're doing a sport that, potentially like soccer or football, depending on, again, where you are in the world, where you heavily use one leg preferentially over the other, then you might start to see differences. But for the calf muscle in most individuals, they tend to be pretty similar between sides. So yeah, so I do, if you're seeing that type of deficit that's above, 15% of, difference between sides, and now I'm talking more about the work output, then yeah, it's definitely something that I kind of suggest to address. So we did a large study here with rugby players in New Zealand, and basically that was kind of our light system, that if they were between 0 and 15% between sides, that we considered that relatively symmetrical. If they were between 15 to 30, that was like, oh, that was an orange, that you might want to address this, and anything above 30% of asymmetry in terms of total work that they could perform bilaterally, that was like, yeah, this really needs to be addressed. And again, that was just our practical application of knowledge on test retest and potential for injury, I guess, within this potential population.
Yeah, and was there any association with risk of future injury or time to first injury from that?
Yeah, so unfortunately, we didn't conduct a longitudinal study within this cohort, so that was really just from our cross-sectional observation. I know that Seth has some work that's about to come out where they looked more at isometric testing of the calf
Oh,
muscles,
wow. Yeah.
and we were able to show that a deficit in isometric strength was linked prospectively to calf muscle injury or
Yeah.
calf muscle and Achilles tendon,
Yeah. Yeah,
symptoms.
that's really interesting. There was a big review that came out recently. Peter Tian and Fiona Hawke were authors. I can't remember the lead author. I think it was Hilton Menz. And they were looking at all the podiatry research that had been published in all foot and ankle research. And they looked at musculoskeletal, and it was like less than 1% was in the prevention aspect. So it's really cool to see that coming out, because it would be awesome if we could have maybe, I mean, I guess with that normative data, if we can bring people up and maybe catch them early. The most important question of this podcast. Now, you would have done so many calf raises. How many can you do on single leg? You'd be at like ridiculous, right? You would have shown so many people, I would imagine, over the years.
Yeah, yeah,
You'd have to be above
yeah,
30, surely.
yeah. My calf muscles aren't too bad,
Yeah.
but full disclosure, I've been struggling with a lower limb injury for about 18 months. Some chronic lower limb injury that's a
Yeah.
little bit acute. I think it's just a resilient to post tendon. I've gone to see a podiatrist, Blake. You'd be happy. So
Yes.
yeah, I've been actually doing calf raises in my own rehab setting,
Mm.
and I've actually noticed that once I stop doing it, I go down.
Mm.
I lose that capacity. So I'm back to running about 50K a week, 60K a week, and
Awesome.
it's yeah. So it's
That's
it's
good.
good. It's taken me a while to get back to this, but
Yeah.
don't train for a marathon when you're approaching your 40s, I guess, is the key take home message.
That's what these new shoes are for. That's what these new shoes are going to help us do.
Exactly. So yeah, so I mean, typically, yeah, I last year I was doing 38. I participate often in my own studies
Mm.
and often outperform the younger
That's
individuals as
nice.
sports
That's nice.
scientists. So I
Yeah.
feel good. I feel good.
Yeah.
And actually, one of the recent things that we haven't actually yet published, but hopefully will come out this year. One of the questions I started to integrate in my studies, which I wish I had done a long time ago, which is obviously a no-brainer. We simply added to our normative data or our test on calf muscle, do you train your calf? Yes, no.
Mm.
And guess what? People that train their calf, they do more calf raises. So it's like, oh, surprise, surprise.
Yeah.
Also, if you don't account for that when you're actually collecting some of this norm data, then obviously you'll have different interpretation of what normal is.
Yeah. And what do you think, because you mentioned it before, kind of total workload, and your app is amazing for this. You can see the height and it catches some attributes that certainly the eye doesn't. We're looking at obviously body weight, single leg calf raise test. It's obviously so accessible for people to do. Everyone can do it. Basically, if you're a human being, you can do it. You don't need a lot of equipment. And there's been over recent years, kind of professional level down to a bit more amateur to recreational, the objective testing, force plates, that type of thing. So, when we're talking around doing this test and we're trying to assess just the calf, what does this test give us? And then what can't we get or what can't we assume? Because we kind of talk around endurance, but then we talk around maybe strength and the plyometric ability, or is it we're pretty confident to say, yeah, this kind of endurance test actually is somewhat predictive of all the other attributes being okay?
Yeah, yeah. So that's a great question, and again, it's contextualization. So yeah, so obviously by design, the calf raise test, when you're asking someone to do as many repetition as possible till quote unquote failure, or a decrease in their performance output. by definition, that's fatigue, right?
Mm.
So when you're doing calf raises to fatigue, it's more of an endurance test. Obviously, it does require some strength to complete. So we often call it a strength endurance test for this kind of particular reason. However, most of this test is typically done at, 60 beats per minute, so going up in one beat, down in one beat. So in 1 minute, you would complete 30 repetition. Pace does not reflect stretch shortening cycle abilities.
Mm.
So it's not a plyometric test. You're not going to get the stretch reflex, and the that eccentric concentric loading that actually elicits a strong stretch shortening cycle. So, for that, you need to go more towards some plyometrics, single leg jumps, for example, jumping off box, if you really want to assess that component of the tricep muscle tendon unit. Now, we've also developed a test that we use primarily in rugby so far that is more of a power test. And again, based on some of the work that Silbernagel had done in the US that we've adapted for more of a kind of field-based testing. And again, like the outcomes the outcomes of that test, although they're related to the strength endurance test, the relationship is not perfect. So you're assessing a different type of ability. So now, power is more your ability to develop force quickly. So if you're doing something quite slow, again, like the calf raise test, then you're not really going to get that power component, right? And
Mm.
similarly, a maximal strength test, like that's done for isometric testing, for example, provides you some information. But personally, I'm not saying it doesn't have its place, but from a functional perspective, it's not very functional.
Mm.
And we do have indications on this or research from this from some of my master's students that basically show actually the performance on the calf raise test, which to me is more functional, more strongly relates to sprint and acceleration than does a seated isometric, for example. And then again, don't get me talking about comparison between a seated and a standing isometric. Like, I do believe there's a place to strength train your calf in a 90% position. Again, like if we really want to target or isolate the soleus muscle, but there's not a lot of movement, of functional movement that we do seated in a 90-degree knee flexion position. So that
Mm.
transference to function is not entirely there, and we see that in the test, or we've seen that in our lab, that if you're assessing straight knee versus bent knee isometric tests, the straight knee almost exclusively always is more highly correlated to any functional outcomes that we might be taking in terms of, running, sprinting, acceleration. So yeah, so there's also
Mm.
a functional
That's
component
interesting.
to consider there.
Yeah, because most people would do, the two really common tests. You have force plates, and you kind of have a bar, and you just do a kind of straight leg isometric with roughly about 10 degrees of plantar flexion, with a straight knee pushing hard into the bar
Yeah.
isometrically, compared to doing a seated 90 degrees, still about 10 degrees of plantar flexion. So that's interesting to know that probably the straight leg, which obviously it looks, even just the classic look test, it looks more like a functional movement. You've got your knee up and you're pushing forward rather than seated. So yeah, that's good. Is it the idea of, we're looking at all these metrics, and it's funny because I'm not aware, and you'll be able to correct me if I'm wrong. I'm not aware of anything that shows, like, let's say someone wants to start running, how do we assess their capacity? And capacity can mean so many things: capacity for running, capacity for life. Are we talking every system in the body? We can't define it, but it makes sense. If somebody can't hop or do one calf raise, the risk of running, or maybe them suffering, it might be a little bit higher, because running is, let's call it a series of single leg hops. So is there anything that you think we have battery wise to be able to say, you can do this? Because we all see people in the clinic and they can do 5 calf raises, yet they go for a 10K run. And you think, how are you doing that? It's like amazing. I'm not going to stop you. Let's work on your calf strength. How, how do these things happen? Are they
Yeah.
just, we talk about compensation, but I'm like, you still need to use your calf. You can't not use it. So yeah, what do you think of that idea of just kind of using running as the training, or trying to do some battery of tests to prepare them, and what could we do?
Yeah, that's a really interesting question. So, I mean, there was a few years ago, there was, I think he's a physiotherapist, Blaze Williams from the US, who had kind of developed this return to run assessment, and some of the components were like you say, there was some hopping, there was some repetitive single leg squat, there was a 90 wall balls, there was a blank test. I always had a little bit of issues with it because I personally didn't think it was very functional.
Mm.
And every year I would actually use it with my undergrad students as an exercise for them to observe movement. And on the basis, like 75% of them wouldn't have been ready to run.
Yes.
Uh,
Yeah. Yeah. Perfect example. Perfect example. Yeah.
and all of them were, sport science, kind of
Yeah.
undergraduate students in their 20s participating in sport, and 75% based on this test battery were not ready to run. Okay, yeah, so obviously to your point, like just because we have some tests and people aren't necessarily, performing them to a certain standard doesn't mean that they can run. So one of the questions that always gets asked is, obviously I'll flip it around, like is running a good strengthening exercise for your calf muscles? Not really.
Yeah.
Again, like the reason why a lot of runners, you can get an endurance runner and you can assess them and maybe they won't do more calf raises than the normal individual, is because we don't go through that full range of motion that you would kind of use when you do the the calf raise. And again, the contraction velocity is different. The calf is just functioning
Is that,
metabolically at
sorry, is contraction velocity how quickly it
how
lengthens? Is that right?
quickly.
Yeah. Yeah.
Yeah.
Yeah.
So and we know that when you're running, it's more like quasi-isometric. There is, some stretch and release. So there's fundamentally it's quite different than just doing an isolated calf strength
Mm.
exercise. Do I think the two help each other? Yeah, possibly. You're still recruiting the muscles. So we know that if you recruit something, it's good and it will become stronger and whatnot. But yeah, I don't think we're quite there yet to have a comprehensive test battery. And again, it just depends also what the injury is, right?
Mm.
Because, if someone has a knee injury, if someone has a metatarsal stress fracture, if someone has an Achilles tendinopathy, as clinicians, we know that some of the tests that we might do for those specific condition, and some of the interventions that we might use will be different to help them to get back to running. So I think it's a little bit, yeah, in a kind of utopic world, we would have, a recipe that says, hey, if you can do exercise A, B, C, and D, that means you're ready to run. But fundamentally, running is probably the best indicator of, are they ready to run? So in terms of reintegrating running into, and let's face it, runners, they just like to run, right? They don't really like spending a heaps of time doing the rehab exercise. So if you can use their exercise as a rehab tool and dose it appropriately to increase the mechanical tolerance to the exercise, then
Mm.
let's do that as well. And some of the adjuncts, obviously the strength training and potentially some of the mobility work, the neuromuscular control, obviously orthotics, footwear, interventions, and everything else that can help people, to return to fundamentally what they enjoy doing.
And do you think, when we talk, let's say tendons, I know there's the different levels of adaptation based off, the percentage, so let's say 70% of the MBC, might be more likely to induce some tendon stiffness adaptations. With muscle, it seems a little bit less, like the muscle kind of adapts to anything, tendon's a little bit more picky. Do you see within the muscular system and for the calf, like if you were to say and recommend strength training, do you think there's a meaningful difference to say going, let's call it 3 by 5 repetitions with a couple of reps in reserve versus just doing 3 sets till failure? Obviously the difference in intensity because the muscles will get into failure, and let's kind of take the adherence. No one wants to do 3 sets of 30 till failure versus 3 sets of 5. It's a bit boring. But do you think, we should probably advocate to go a bit heavier?
Yeah, I think that is probably something else that I've changed my mind a little bit over the years.
Mm.
Obviously, when I was kind of trained as a physio, your go-to was, three reps of 15, or, between
Mm.
10 and 15 for everybody. Whatever the rehab exercise was, that's what we gave them. And, there's kind of convincing evidence now, I feel that, even from a performance perspective, if you want to get stronger, you need to lift heavier, right? So, maybe a 3 times 10, 3 times 15 will get you to maintenance, but it's not necessarily going to get you necessarily that much stronger. Now, again, I'm not a strength and conditioning expert. I don't necessarily spend my time in this realm of exercise prescription based on dosage. But from my very kind of naive understanding, and my own personal, like if there was one thing that I would do outside of my running for myself, would be to go in the gym and lift heavier. I hate it, so I don't do it. And that's on me, and maybe that's why I'm
Yeah.
injured, But I wish I enjoyed it, because we know there's a lot of benefits, and we know, even later on, later in life, for example, the older individuals are more functional, they're more mobile, when they're stronger.
Mm.
and they can still adapt. You can still get an old person to start strength training, and their muscles will get stronger and they will get better. So yeah, I do think that we need to use, again, heavy load wisely in our rehabilitation and potentially prevention of injuries as well.
Yeah, it'd be great to see some prospective data come out to say, this level is associated with this risk of injury, for something to work on. Because as you know, running injuries are so high. And that, kind of brings us into maybe the best prevention strategy we have, which is buying more shoes, maybe buying more super shoes. Now, I just wanted to ask, of course, you obviously spent a lot of time reading about shoes and the technology, advancing technology, and I'm sure maybe, just an assumption, maybe one of your social media feeds is just feeding you shoes. But what is your favorite running shoe and why? Because you've obviously been, I wasn't running when the kind of the switch around 2016, 2017. So I wasn't in those shoes back then or just really noticed the difference. So yeah, I'm interested to hear. I'm thinking maybe barefoot shoes. What are we thinking?
Yeah, that's a tricky one. I can't really say that, I don't really have a strong brand affiliation. I used to be a glycerin runner. That's before
Mm,
I got into research and everything else. And so
yeah.
really just like anybody else. And now I know that, and obviously I'm from North America. Now I appreciate that in North America, if you bought a glycerin shoe, the salesperson would get $15 commission on the side. So there was an
Wow, I
initiative.
didn't know
Yeah,
that. Yeah, okay, I
yeah.
did not know that. That's not good at
No,
all.
no, so I don't think that's allowed here in New Zealand, but there was some incentive for certain, kind of shoes to be bought out more, for
Mm,
example, and glycerin became one of the key, running shoes. Now, obviously, over time, things happen and everything else, and yeah, I jump a little bit more on the minimalist
mm,
bandwagon, only because I think conceptually I like the idea. I believe the
mm,
body can adapt. I believe the body adapts. And as long as the loading is progressive, then yeah, your body can adapt to that. And before the advent of super shoes, we did know that one of the key drivers to performance was a reduced weight of the shoe. So a reduced weight of the shoe fundamentally meant a more minimalist shoes. And so it was after my maternity leave when I had stopped running for a while and was coming back to running. I figured, well, this is a good time for me to do the switch because I need to readapt to running. And I switched to more minimalist shoes. And yeah, could quite comfortably, run, 20, 30 kilometers in New
wow,
Balance minimalist shoes. So that's what I was
that's
tending to
awesome.
run in. Yeah,
Yeah.
yeah. So
Did it
it
take
was
you
good.
long to get to that? To get to the
It
20,
did.
30K? How many, like
Yeah.
6 months or a bit
Uh,
longer? That's
yeah,
awesome. That's really cool.
about that. Yeah, and
Yeah.
I remember in my training getting to a sense of tapping out at 14K. I got to
Mm.
14K, and for quite a few weeks I thought I can't run longer in this. Like it's just not gonna happen. And then all of a sudden, like I could. Um,
Mm,
so yeah, so it was an interesting kind of experiment I did on myself. And yeah, and then I started to quite like the New Balance more designs. And I've kind of stuck with New Balance mostly because I feel they still have options of not so maximalist design. So one of the
mm,
shifts that has come along with obviously advanced footwear technology is that at least here in New Zealand, you go in a shop and most of the shoes are like this high. It doesn't matter what you look, any shoe for running, it doesn't matter. It's like that big. And that is not my go-to. I've now adapted to a more kind of low profile shoe, and I feel like I'm falling forward if you put me in something that, has a huge stack height and has any sort of drop. So yeah, so I guess that would be my kind of favorite. Full disclosure, when I ran my marathon in, late 2024, I ran them in Vaporfly shoes. Why? Because I wanted to run faster,
fast.
and it was my first marathon in quite a few years, and I ran it in 3 hours 17 at almost the age of 40, and I was quite chuffed with myself because
Wow.
I was
Awesome
happy.
time.
Yeah, it was good.
Yeah.
I've been struggling since, but whatever. Um, but yeah, so again, it depends what you're wearing the shoe for, I guess, and I think your favorite shoe depends on what type of running you do and what purpose you're using them for.
Yeah. Certainly like the purpose and the adaptation, like a colleague of mine who knows a lot about shoes, Michael Nishki, he was telling me like he's been running for such a long time, and he was saying even prior to, the super shoes, like he would do a tough workout, and he's a really quick runner,
Mm.
and his calves would pull up sore for days. And I was speaking to him like, I've never really ever had sore calves after work. And he said, the shoes have such influence, over that area, and maybe it allows people to run more, and maybe it gives people that would maybe take a little bit more time to build into running, a bit more enjoyment, a bit more fun, gets a bit more physically active so they can play that role. But, talking around the biomechanics, I guess, what are the main things that we see that are different, between these higher stack? And if we kind of say, if we categorize minimalist shoes and then we call super shoes or advanced footwear technology, but then there's always this other category of like the advanced super trainer, and it's basically a high stack, relatively stiff, but they don't have a carbon plate, but they act very similar. So,
Mm.
I mean, what would we say the difference is between these shoes now, like biomechanically?
Yeah, so I mean, generally we know that running in advanced footwear technology type shoe, that's typically associated with slightly longer ground contact time, but you also spend more time in the air. So so there's kind of like that trade-off. So spending more time in the air, you also get more higher vertical displacement. But because you're longer in contact with the ground, it tends to reduce your running cadence as well. So you tend to see a lower running cadence. You also tend to see obviously reduced ankle plantar flexion velocities, which has been proposed to be associated with some of the metabolic benefits that you get from advanced footwear technology. There's generally a reduced amount of work that happens around, the metatarsal joints and the ankles. But the flip side to that is that there's been recent research that suggests that it tends to increase the bending moments within the metatarsals. So even though the peak pressure and the work within that region might be reduced, the bending moments on the metatarsal bones tends to increase, which might
Mm.
potentially be linked with some of these kind of stress fractures that we're tending to see potentially appearing with advanced footwear technology. So yeah, so there does appear to be a little bit of a shift. Now, obviously, because advanced footwear technology type shoes, the foam is quite different, and they do and again, like we've done some qualitative work in this space where people report that they feel unstables around corner, for example, which again, from a mechanical perspective, makes sense, right? So if you're putting someone in, a higher heel and they're turning a corner, the foam's a little bit more, compliant, it's a little bit more squishy, so then they feel unstable. So, research also confirms that you tend to have a greater eversion
Mm.
excursion at the ankle joints. Some work tends to suggest that, particularly in women, you tend to see more, abduction and adduction hip moments as well. So, we might be reducing in certain individuals, reducing some of the lows around the ankle, but you might be generating different torques somewhere else, like at the knee and at the hip. So yeah, so again, there's a few different things that we tend to see happening.
Yeah, and do you think the question, of course, is does this mean anything? Because it seems like if we looked at anything else in our world, that it's not often that you can have something that is so beneficial in the sense of it feels good. It clearly, for most people, makes you run faster. It seems like there's going to be a trade-off. Maybe the trade-off's just how expensive they are and how quickly they wear. But what do you think? Is there any trade-off, kind of to the human body? I know there was an RCT that came out recently, showing that there was a reduction in injury, but I've read that paper, but I haven't been able to find like the clearer methodology. It was a really short paper. The protocol, sorry, I couldn't find their protocol. There was a bone stress injury paper that was a bunch of case studies, which, it's hard to draw any strong conclusions from that. So, yeah, where do you think we're at?
Yeah, I think fundamentally we don't necessarily have enough strong evidence now to, be definitive in terms of, you know, does AFT, prevent injuries? Does it increase injuries? In my general kind of, Kim's view of the world is that um, I think we're probably just shifting injuries somewhere else. We
Mm,
know that, running injuries are more so related with load. They're more related with, potentially training changes, training errors. We know that injury risk tends to increase when people switch shoes because, again, then they've adapted to a certain shoe and now you're putting them in a new environment. And then, so then and they need time to adapt to the shoe. So early on, then potentially, yes, the injury risk might temporarily increase in advanced footwear technology. But again, do people always train in advanced footwear technology? I know I don't know about you, but I mean, I can't afford $400 shoes,
Either.
every 6 weeks, for example, and, I'm generally an unsponsored researcher and scientist. So, I just, and I don't have a sales rep, and I'm not a footwear representative. So I don't get free shoes. So I'm just like everybody else in this world that, has to buy their own shoes. And yeah, so I mean, again, like, I don't think that's necessarily also a fair comparison in certain of the studies where, for example, Laurent Malissou is quite a well-known researcher
Mm,
within this space, and they've allocated shoes to individuals where they have higher drop and lower drops, for example, and then prospectively look at people over time. And then, that gives us potentially a clearer indication of, certain features and how they're associated with injury risk. I don't know of a study where they actually go, okay, no, you need to exclusively train in, these kind of advanced footwear technology shoes, and we'll give someone something comparable, but that's not an advanced footwear technology shoe, and then track them over time. Until we have something like that, I think it's really hard for us to say whether advanced footwear technologies increase or decrease injury risk. And again, in my view, it might just be increase, decrease, depending on what injury we're talking about.
mm,
So I think there was one study that was published in, from the Footwear Science Symposium or Congress. There was 2 or 3 different studies on potential for injury. One of the studies, I think that you mentioned, showed a general reduction in injury. The caveat being that, it was sponsored by Nike. So, it's kind of,
yeah, exactly.
yeah. And,
Yeah.
and to your point, like, there wasn't enough detail to really know, what the protocol was and things. And then there was another study that was from, I think, Tony Arndt's lab, where they had showed, compared to a neutral shoe, an increase in calf and Achilles injury, if I'm not mistaken, in advanced footwear technology compared to a neutral shoe.
Mm,
Lesser knee injuries, I think, from
yeah.
memory. So again, I think it just depends what injuries we're talking about.
Mm, yeah, I mean, if you do a study like that, please include me. If you want someone to wear lots of super shoes for a long time, I'll happily do that. It'll be a very expensive study. Yeah, it's interesting because there's a lot of buzz and conversation, especially with running being very popular. But yeah, it's certainly an individual conversation with someone. If maybe they get out and they be more active and they enjoy wearing the shoe, what's the detriment of them being a little bit less active and not going out and enjoying their physical activity? So that's interesting. Do you
Oh,
think?
absolutely. And we can have the same conversation about any shoe, right? So now we're talking
For
about
sure.
advanced footwear technology. And I think that was one of the questions you kind of wanted to talk about was, is comfort the best
Yes.
indicator?
Let's hit it. Let's go for it. Just tell me, because there is so much around. What do? You come in flat foot. Let's give you this one. All right, let's get you on the treadmill. I'll spend 20 grand on this new fancy treadmill, and we'll test your ground reaction force, and we'll find if you're a bouncy runner or you spend a lot of ground. And does it all come down to someone puts a shoe and goes, yeah, that feels good. Like, that's our good predictor. So, I mean, it sounds very logical. And that's what I tell patients, like, just be comfortable and, have some of your features that we need and let's go from there. But yeah, what do you think? Everyone's on the edge of their seat for this one. I'm ready. We're
Yeah,
excited.
yeah. Yeah. So how much time do we have? No. So again, I think it's not a straightforward answer in the sense of, again, if we're saying, hey, if nobody's going to go run in a shoe that's not comfortable, right?
Mm,
So if we give you a shoe and it's not comfortable, it's probably because your structures, don't like pressure points on it and everything else. And yeah, I mean, inherently, it's quite basic that it will probably end up causing you discomfort or causing you an injury because your body's already telling you that it's not comfortable in that, in that kind of space. Now, the thing that bothers me about just the comfort aspect, just solely relying on comfort, is that we know that it's mediated by a lot of different things. So
mm,
first and foremost, footwear comfort is often linked with how much cushioning is in a shoe. And that's why, Hoka has done so well. There's a lot of cushioning in a Hoka shoe. You go and put on a Hoka shoe, it feels really comfortable because you're like standing on a pillow. But, again, and I don't, I could say Hoka, I could say anything else, any Maximo shoe. I personally don't like Maximo shoes myself. They have a place though, if someone is going to be comfortable, is going to get them out running, if they're doing it in a Hoka, good for them. Do I think it's the best shoes for them? Probably not. But am I going to tell them not to buy a Hoka shoe that gets them out the door running? I am not going to do that. So again, like if for them that works and it's the most comfortable, that's great. You go out and do that. But, like we recently published a study where we did a sham gait analysis and, we told the individuals, hey, this shoe is for you. You know, it's matched based on your foot type, based on the way you move, based on how you run. And on this basis, this one matches you. And then we gave them the exact same shoe, just in a different color. And we said, okay, well, this is just a neutral running shoe. It's just, you know, yeah, it's good for running, but we haven't necessarily matched it to you. And again, almost all the runners preferred the one that had been recommended to them. Didn't change the running gait. They ran exactly the same. It was exactly the same shoe, but they were more comfortable in it and they preferred it. So just the fact of us doing what we do in clinic, doing what we do in a shoe store, and telling them, yeah, based on your foot type, which we kind of know from military research that doesn't necessarily help to, matching someone's foot type to a shoe construct doesn't actually necessarily reduce their injury risk, but just telling them that it's a shoe for them makes it more comfortable. That's why I use comfort as a, with a grain of salt, because I know that it can be manipulable and comfort can change over time, right? And like even in one of the follow-up studies that we did, people were, enjoyed their shoe more right at the start. And then a month later, they were a little bit less comfortable. Why? Well, potentially because the cushioning had been compacted a little bit. It wasn't as cushioning as when they originally, had it. It wore a little bit with their gait patterns, so they were less comfortable in it. So again, I think comfort is a good tool. And yeah, if it's going to help someone stay active, then sure, go for it.
Mm.
But again, people can adapt, right? So as long as it's not uncomfortable, then I think we're doing okay.
All your papers are just shifting through my head because I'm trying to make sure I reference the right paper. But correct me if I'm wrong. In that paper, which is an awesome paper, it was something like 89% said that would lead to, they thought that would have an injury reduction component
Mm,
to it or something like that. It was quite high.
mm,
And that comfort filter, and you raised a good point about it changing over time. So I know you published another paper talking around how people describe minimalist and maximalist shoes, or just minimalist shoes? Because we always assume if you run in a minimalist shoe, so if you or I go out for a run, we're going to describe it as, dead, not snappy, not bouncy, not a good shoe, all the attributes that we would associate with not a good shoe. And a maximalist shoe is bouncy, cushioned, fun, that type of thing. And your study showed that the minimalist shoe had all the good attributes that we would expect anyone to report in a comfortable shoe, right? So it's not, was that correct?
So
Yeah.
this was a qualitative study that I did in collaboration with Ben Peterson
Mm.
and Hannah Knighton. And so the study was that we got individuals to run in their own shoe, they got to run in a minimalist shoe, and then they got to run in a Nike Vaporfly, so an AFT shoe, obviously a little bit more maximalist. And yeah, so what people reported was different. So we had it was 18 runners, and yeah, some runners really enjoyed running in a minimalist shoe. They felt it was natural. They felt that it made them their stride easier because the shoe was lighter. They felt it was more responsive. In contrast, some people loved the AFT shoe. They felt that, yeah, it was bouncy. It returned to them. But we also had the opposite. So some runners felt that the AFT shoe, they said it felt like running on sand because they felt
Mm.
like they kind of compressed it down. They felt unstable. They didn't like it. And, we had the same with the Milma shoe as well, that they felt like, it was jarring was some of the terms that they used because they then kind of felt the impact a lot more. So yeah, again, it's very individual specific. And if we kind of lose sight of that, then, and you can only know that if you're able to try them, because that was something else I was interested in that qualitative study that we did, is we got people just to look at the shoe first. Almost we
Mm.
wanted to try to replicate what it would be like if you go in a store and just looked at a shoe and just picked it up. And then you already make your mind as to whether or not you're going to try it on, right?
Yeah.
And what was interesting in that is obviously if you pick up, for example, an AFT shoe and you try to bend it, you can't because there's a carbon fiber plate in it, right? So it actually feels like it's going to be really stiff and it looks a bit bulky. So people are like, no, I don't think I'm going to like running in this. And then, then they got to put it on and we just got them to like run around a little bit up and down, bounce and, kind of got their perception. And then we actually got them to run in it. And like by running, they ran 1K in it, so a proper kind of run in it.
Mm.
And then we asked them, would you buy this before you ran? And a lot of them were more kind of hesitant. And then after they ran, then they were like, oh yeah, now having run in it, now I would buy it, obviously depending on the price and things and some
Yeah.
recommendation that they might get from other people. But that experience of running in it was able to shift people from saying, oh, actually, no, I'm not going to buy it, to yes. And more often than not, we saw it go that way and a little bit less going the other way, where they switch from, yeah, I think I would buy it, to no after having running in it.
Because if you were saying before, like comfort's usually associated with cushioning,
Mm.
that obviously can be variable. So if someone needs to just try the shoe on to be able to get an understanding of what they're going to like, because I'm assuming if companies know that, they just make shoes bigger and squishier and more cushioned so they feel good, and you have that first step comfort, and you
Yeah.
associate, wow, this is comfortable now, I'm much more likely to buy. Like it is hard to say that. But it is interesting knowing that if you try those two on, like it can make meaningful difference, which kind of leads to the next question of, when buying shoes, obviously we just spoke around comfort, but, the idea of doing a gait analysis to see how someone moves, is that truly worthwhile compared to just, here are 3 or 4 shoes? What have you run in before? What have you thought that you've liked? Here are 3 or 4 shoes, try them on, run them, all of them, and then to see what you like. Like, is that the kind of best way forward, do you think?
Yeah, I think fundamentally, and again across some of our research, particularly with Andrew Fife, where we did ask some of these questions, like what's important to you in your footwear selection and things. Number one was always comfort. Number two was fit of the shoe. And number three in people's minds were a gait analysis. So, actually having someone look at the way they ran in it, and whatever it did to their. Now again, that's a little bit different in terms of what you are prioritize. If you ask people what do you prioritize in a shoe, they'll say injury prevention. Then they'll say performance,
Yeah.
and then they'll say, something else. But yeah, so I think obviously that comfort aspect is important. Fit and comfort, they're kind of linked, obviously. If your footwear doesn't fit, you're not necessarily going to
Mm.
be comfortable in it. But so yeah, so again, that's a little bit contentious to say, yeah, comfort and fit, and then yeah, the gait analysis. But I think if someone fundamentally, if you don't run in a shoe, like walk in a super shoe, it's definitely not the same as if you're going to run in a super shoe. And we know the biomechanics as well. So there's actually been recent research that has looked at people walking in super shoes, and there's no metabolic advantage of walking in a super shoe compared to walking in a standard shoe. But if you start running in it, then it feels completely different, right? So again, so unless you have the opportunity to actually run in it, and not just like a 2-minute run on a treadmill, but and I know we can't just let everybody go run,
Mm.
3Ks in the shoe and return them or whatever. But yeah, I do think that you kind of need that run test as well, and more than just a run up and down the corridor of the shoe shop.
Yeah, you got to save the foam. Got to save the foam. You can only go a couple of meters. So you like this psychology aspect. Is really interesting because we see that elsewhere in the human body. Someone has back pain, they go to the physio, or they're certainly not going to the podiatrist. They go to the physio or the chiro or the doctor, and the words that they use and how they communicate and their experiences, all affects. In some cases, just how much pain they report, let alone their response to the treatment. So it would make sense that that would be similar in the footwear world. But it is more shifting online now. People are buying online. Companies and smaller footwear places are selling them online. And you published something recently, which I really wanted to talk to you about. The idea of creating footwear reviews are huge now. Websites explaining how a shoe feels for them and how it works. I mean, just on the topic of footwear reviews, I mean, what do you think? I do footwear reviews, and I try to acknowledge in them that I am a very different runner. My weight, my experience is what I enjoy. I like a stiff shoe. I really like it to be stiff compared to other people, like my partner, like a soft shoe. So, do you think they're valuable? Do you think it really gives any merit? And then, second to that, do you think that it really influences our choice? And you can go as hard as you like. We'll still be friends after, hopefully.
To your point, I think a footwear review is so individual specific,
Mm.
so a shoe that works for you is not necessarily going to be a shoe that works for me. So, for example, Blake, if you have a follower that's like, oh, any shoe that Blake likes, I feel that I like, and then like maybe that's really informative for them because they know that,
Mm.
their body responds in the same way, they perceive the shoes in the same way, and maybe for them that's really informative. Now, maybe somebody else would be like, oh, that Blake dude,
I
shit,
hate that guy.
and, like, I hate that guy. His reviews suck. And but that's informative as well. So they know that they're not going to like a shoe that you've recommended because,
I like
like,
that. So I'm helping both sides here. I'm
yeah.
helping both sides. That's good. That's good.
But like unless you know that though, like I think
Yeah.
it's difficult. Now, does it have an influence? Yes, we know it has an influence. Like people report that they look on social media. People report that they're influenced by their family and their friends. People report that, the opinion of others matter. So we know it's having an influence on how they select their shoes. Now, whether it's a good influence or a bad influence, that's a whole other topic. So again, you do you. I'm not there to tell you what to do or what not to do. Do I personally rely on footwear reviews from other people? Hell no. But that's me. So like
Yeah.
again, like it's yeah, I don't think there's one yeah, there's kind of different ways to skin a cat, I guess is what they say, but not
Mm.
that's something that I do.
You're the one that's leaving all those bad comments on my review, so I'm only kidding. So do you like where do you think we go from here? Like with the technology, I mean, you would have seen. I feel like the Nike Premium was probably the example of that. That 55 stack. Mizuno's had a couple. They've kind of come back down. I mean, do you think it's going more towards making the shoe more personalized? Like we can understand maybe some better measures. Maybe beyond comfort, or there's footwear testing so we know truly what's the best economical shoe. Maybe it's not even comfort, it's just most economical, or maybe 3D printed shoes, so fit and comfort, maybe much more likely to happen. What do you think?
Yeah, obviously now with, big data and AI and all of the assessments that we can do, 3D foot scanning and all of that, I would like to think we get to a place where, someone could come in and yeah, they have a assessment done and then they're like, hey, this is the perfect shoe for you. Now, again, what's the perfect shoe though? Perfect shoe in terms of injury reduction and a perfect shoe performance might not actually be the same, right?
Mm,
So again, I think it kind of depends what we kind of say, perfect it is. But like we can even talk about military, for example, right? Because we know that militaries they go and they train a lot, and we have a lot of good studies done on shoes and the influence of shoes on injury risk because
mm,
we standardize their training load and then we kind of add this as a intervention and see kind of what happens. But imagine a world where your army recruit would come in and then you could 3D scan their feet and then we give them the perfect shoe for them that will reduce their injury risk. Maybe we get to that point. Now, on the flip side of that, towards personalization, and if we think about technology in shoes and everything else, there's sustainability, right? Footwear contributes a lot
mm,
to carbon gas emissions in the production chains, right? And then if particularly we're saying that there's some research that indicate that a super shoe is only really good for, we know it doesn't last as long as a typical EVA shoe, for example. It loses its properties more quickly. So what does that mean? Well, that means that we need to replace them more frequently. And, now we have carbon fiber plates inside of them that we're just kind of chucking away in landfill. So really from the sustainability standpoint, is it really something positive? Well, probably not. And then there's also the equity standpoint, right? So again, we talked about cost of these shoes. Well, can everybody afford a $400 pair of shoes? Well, actually no. And one of my biggest concerns is particularly in the youth and development space. If you have people that are really good runners, aspiring runners and everything else, but they don't come from a well-off wealthy family, or that they're not in one of these American schools where they're sponsored by a footwear company that have access to shoes, and you're already causing this divide in terms of, well, we know advanced footwear technology shoes work, but we're not going to, these people don't have access to them. Well, what are we
mm.
doing to the sport, and is that actually helping us really identify talent and good athletes, and do they then exit the sport because they've already were at a disadvantage from the get-go? So I don't know, there's some more philosophical question going away from the biomechanics and the
Mm,
injury and
mm.
everything else, that I think it's all great, these technological advancements and everything else, but everything is moving so quickly, and obviously we live in a world where money is important to a lot of people. But what's the downside to some of these innovations and some of these drivers and some of these manufacturing processes and things like that? Yeah, is a little bit, yeah, humbling, I
Yeah.
guess.
No, I agree. Moving into kind of consumerism and what that means, it's really important, especially in shoes. One kind of myth that I wanted to ask you is around this technology and this idea of, responders and non-responders, and if you run at slower paces versus faster paces, and this idea, is it just too variable to be able to say, or, do you need to be running 4 minute pace and you need to be 60 kilos to truly get the benefit? Or is it just a matter of, we don't know unless you can have some testing, and someone running 5:30 pace at the same weight or even heavier would be fine? What do you think?
Yeah, I think the goalpost is shifting all the time on that one. But yeah, the earlier studies tended to indicate you gain more benefit if you were running faster. You still
Yeah.
gain benefit at a slower pace. You just gain more if you were running faster. Now there's been a recent study that's come out that kind of said, oh, at even really slow running speed, you still get, the
Some
same
benefit.
the same metabolic benefit. So
Yeah.
I think some of that is potentially due with, response status, baseline characteristics of individuals. We have a study that we've been trying to get published, on this topic, where we had responders and non-responders.
Mm.
Funny enough, the reviewer was like, I don't like the condemnation between responders and non-responders, which again, it's a blunt tool, but from a practical standpoint,
Yeah, that's important research. That is very important. If you talk to anyone in the running community, they want to make our own journal. Yeah,
yeah,
that's
yeah, yeah.
okay.
Maybe I'll put you down as a potential reviewer.
Yeah.
Conflict of interest. Yeah, yeah. But we assessed a heaps of variable, from foot
Yeah.
posture to foot strength to calf muscle function to stiffness, and we particularly targeted a heterogeneous group of runners because we really wanted to look at some of the relationships. And out of everything that we kind of looked at, there was only 4 variables that potentially explained a little bit those that tended to respond more than the others. And good for me, it was related around, calf stiffness and gear
Wow.
ratio at the ankle and calf muscle strength. But out of everything that we looked at, there was really only a few factors that tended to explain it. And within our data set, the faster runners, the slower runners, the males and the females responded exactly the same. So that wasn't a
Wow.
driving factor. BMI wasn't a driving factor. So again, it
Tim,
was,
you gotta get this to my head's exploding right. I'm just picturing all the runners that this is going to be okay. Well, please let me know that accept that gets public, because that would be awesome. Because that's kind of, people kind of assume that anyway, but kind of it's just anecdotal. I'm like, yeah, I respond to this shoe or that shoe or these characteristics. So that would be really cool to have like a couple of things. If 3 or 4 of these are met, you're much more likely to respond. That would be really cool.
mm,
Yeah. Okay.
yeah.
And
And
there's.
yeah,
Hmm.
you'll have to get me back on then when it actually gets out.
Yes, that would be awesome. So the last one I wanted to ask, sorry, third last, the last two are unrelated to biomechanics. The last one is this idea, and I completely fine because it's hard to have an answer of, let's say, like I agree to the capacity building. Like I work in barefoot shoes in my clinic, and then I run in some lower drop and some high drop and kind of mix it up. But I'd be lying if I said if I love running in minimalist shoes. I love to run in a stiffer shoe, and it's kind of somewhat protected, maybe running upwards as I'm increasing my miles. But it's challenging to say because we do have some literature to show running in minimalist shoes is associated, with people reporting a little bit more pain. There's some injury risk potential in obviously the change from maximalist to minimalist shoes. So I'm aware of 2 studies, some over 16 weeks, some over 6 months. The transition's hard. How do you know this person's really high risk? They've had a history of, let's say, tibial stress fractures and Achilles tendinopathy that they dealt with 2 years. How do we help them transition if they want to? And certainly we would all agree that it's awesome for your body to be able to do that. And surely it's just a great way to build strength and capacity. So yeah, how do you do it? Do you just kind of say you're high risk, you take this long? Like, how do you kind of bring it into the week? Or and then how did you do it for yourself, I guess, as well?
Yeah, I think, well, obviously gradually. I think listening to your body is, a number one. So I'm someone that's very sensitive to biomechanical changes, and I will get an injury relatively easily if you change something. So I know that from myself. It's taken me a while to And once I'm injured, I actually take a long time to heal as well. So if someone wants to, give me an explanation as to slower healers versus, quicker healers, because we all see that. And so I don't know if you have experience from your clinic
Mm.
that you have people that actually heal a lot more quickly than other people. If you have an answer to that, you can share that with me.
If you tell me the answer to footwear, I'll try and come up with the answer for this. We can trade.
So yeah, I mean, the truth of the matter is we don't necessarily have a guiding principle for transitioning to new shoes,
Mm.
basically, and how long that should take. Now, I know obviously the running clinic and Jean-François Estrillier and Blaise Dubois, they kind of, suggest that for any 10% change in the minimalist index of a shoe, you should look at least 1 to 2 months of transitioning time, for example. So the bigger the change from where you are to where you're going, the longer you should look at
Mm.
incorporating that new shoe within your transitioning program. So if you're having a 50% change in your minimalist index, well, then actually, yeah, it might take you 4 to 8 months to kind of fully transition all of your running within that shoe. And again, maybe that's not where we need to get to either, right? Like, for my 30K runs, yeah, then maybe I might just want a little bit more cushioning, but that's just more for the comfort of the metatarsals.
Mm.
And that's fine, and so I am a believer in kind of footwear rotation as well. So, I often end up having the two pair of shoes and I just kind of switch between them. But, just to kind of give a rest to one of the shoes to kind of, come back
Mm.
to, its fundamental properties or whatever. But yeah, I don't think we have a clear answer for that, except that it's, sometimes common sense,
Mm.
as a clinician and as a kind of runner, most of the time people kind of know. And I'm jealous of some people that can, and I know some people like this, they can get a shoe the day before a marathon
Yep.
and wear it and run the full marathon and have zero issues, absolutely zero issues. I would never in my life do that. Never,
Mm.
because I
Yep.
guarantee you that within 10K I'll be injured. So there's differences between people as well, and I think that's why we don't have a hard and fast rule.
Mm.
But the bigger the change, maybe the more gradual the transition, and just use some common
Yeah.
sense.
Yeah, I really like that 10% on the minimalist index because it's somewhat objective. It just gives you a bit of a rough, obviously an approximate guideline, but I don't know that. That's really cool. So the last two questions. Now, I'm more interested in this one now doing my own PhD because I'm understanding the challenges with recruitment and money and personnel. So if you could do any study at all. Money's not an issue. Recruitment's not an issue. Ethics, you're still within ethics, but that's not an issue. Anything that you would like, what would you do? What would you aim to do? Or what would you want to find, I guess, if you could do anything at all? And I purposely didn't put this on here because was just wondering if you just kind of had it soothing, in your brain.
One of the areas that I've become really interested in since being in New Zealand is influence of footwear on children's feet and their development
Mm, yeah.
and the
Yep.
potential for long-term, and again, I'm biased, so I'm going to say long-term benefit on musculoskeletal health later in life. So, for example, my son, he's 8, and people don't get this when they're from overseas, and I didn't get it coming from Canada. My son is 8. He does not go to school with shoes. Like, we struggle to get shoes in his school bag.
Wow.
And he's not comfortable wearing shoes. Like, and I have a friend that her son is 12 and he just ran a 10-kilometer race on concrete barefoot. He started the first
Wow.
kilometer and was uncomfortable, chucked his shoes behind a bin and ran the last 11 kilometers barefoot and ran faster than his mom on that 12 kilometer.
That is amazing. That's so
No,
cool.
it is. It's
Yeah,
so
it's
cool. And
so
I
cool.
just find it fascinating and I love it. Like I find it beautiful. And from a functional perspective, it's just like, to me, that's the natural growth of the foot. If we're not impeding with it, if we're not, restricting it, and if we're letting it do its thing, what does it do? And we
Mm,
know that footwear, leads to Hallux valgus angles and bunions and everything else. But we also know that people that go more barefoot or that go in more minimalist shoes, their foot gets stronger. The cross-sectional area of their intrinsic foot muscle gets bigger. They have better balance abilities. They get better foot strength. Now, imagine if growing up barefoot helped to reduce falls later in life. So
yeah.
if I had like money and time and whatever, like I would follow people. I would follow people over time from very young age up until, later on in life, and see, does it influence their injury risk? Does it influence their musculoskeletal health? Does it influence their risk of falls, for example? It would just be, showing that would be kind of like, wow, I would love that. But obviously we
Yeah.
also live in a concrete world, and I realize that, there's, you know, kind of public health concerns and infections and whatnot. But, if we had a really clean environment and where people could, yeah, grow up, barefoot and be barefoot, what would that look like?
Yeah, that's amazing. I mean, I see mostly adults, but maybe one, two, three kids. But using the context of pain, so I mean, will a shoe safe for sevens will make them sore, but we see a lot of people just for screening. Kids come in with their mum's, dad's concern. They have flat feet. Almost always it's completely fine because they're asymptomatic and they're functioning well. But my recommendation for them, that's changed over the last several years is. I used to just say, great, you just need a pair of shoes. But now I'm like, great, you've got the opportunity now to get an anatomical, flexible shoe. Still has some protection from rocks and glass and stuff like that in school, but anatomical fitting, Bear Barrett's a good example, Paper Crane, Vivo Barefoot, and they're great for them. And it makes sense that if you can, it's just going through so much development at that age that if you put more strain and stress on them in a healthy way, that it might make their bones denser or their tendon a bit thicker or their muscle, a little bit bigger. So I agree with that. It's awesome to see the contrast between the biomechanics and then that, because I feel very, very similar. So that's really cool. And then
Yeah.
last question. If you could sit down with anyone and talk to them, doesn't have to be a health professional, who would it be and why? I can't remember. The last person said it was a previous mentor. It was an orthopedic surgeon we had on Talk Around Navicular Stress Fracture. He said a previous mentor that had passed away. So, and other people have said, we had Dr. Bradley Neal. He said it was from a band who I'd never heard of. And I usually know a few bands, so it made me feel like a young kid because I couldn't remember the band. Yeah, who would it be?
That's a really tough
Yeah.
question. I don't know. I'd almost like to like go back in time and, just uh, particularly women trailblazers like in the field or just like in life in general. Someone like Joan of Arc or something, that just kind
Wow.
of
Yeah, yeah,
someone that
yeah.
just did something that's, outside of their time and just kind of led the way for other people, and just really like people like that. It's just they just inspire me so much. Yeah, it'd be someone like that, or have like a sit down with Oprah Winfrey or something, like
Yeah, there's always that one on the side. Yeah, yeah.
you
There's like
know.
all these different domains that you would go into. Yeah, that's really
But
cool.
yeah, yeah.
That's a good one. That's a good one. So yeah, thank you so much for coming on. I appreciate it. We were saying offline, and I know you're very humble, so you won't like this, but your name comes up a lot. Talking about other podiatrists and even some footwear reps and your infographics on LinkedIn. It's awesome, and you're publishing quite a lot. And I saw you to share some statistics around what we would call our Bible, the Footwear Journal. And I love going to the journal and see the issue come out and all the new papers. Like there's some really cool stuff, and you're very popular in that journal, as I can see, and rightfully so. So I really appreciate you coming on. Everything that we spoke about, in the papers we spoke will be linked in. And I feel like when let's I don't want to say because I know you won't like this, but a bit like a celebrity when you're like, yeah, I know all about. I've got your papers in a folder, so it's so easy just to link them through. So it's really cool, and you're doing awesome work. So yeah, I appreciate you coming on. And if people want to find you, I'll tag your stuff because you're mostly active on LinkedIn, right? That's your
Yeah, yeah,
main
yeah.
platform. Yeah,
Yeah, I've
yeah,
shifted a couple years ago, obviously away from X to
yeah.
LinkedIn now. So yeah. Oh, thanks, Blake. That's really kind of you to say.
Yeah, very good. And any parting words that you would say? Anything to watch out for? We're going to watch this space because because you're basically what I'm picturing is this paper is going to come out and it's going to tell me if I'm a super responder. Then I can blame my marathon PB and say, I'm actually really like a 3:05 guy when I'm like 3:30. I'll blame the
Yeah.
shoes. Blame the shoes.
Yeah. Yeah, for sure, for sure. No, just, thanks for having me on, and obviously all the awesome work wouldn't, I never work in isolation. I'm a very collaborative person, always looking for future talent. So, look forward to seeing what you do in terms of your PhD and what's going to come out of that, because I'm sure it's going to be awesome.
Yeah, thankfully, when you said that there's some things that you can't get from running that you might have to get from resistance training, I was like, whew. I feel like that's part of my research question, so I don't want to be that's good. That's good. So yeah, see how that goes. Hopefully to do some footwear stuff would be really cool into the future. Just got to get the shoes is the problem. To come and just say, here's 100 shoes, do what you want with them would be nice.
Yeah, absolutely. Living the dream.
Yep. Yeah. Very good. All right. I'll see you later, Hugh. See you later.